Hi everyone. So I just thought I'd jump on and say a few words about the article that I posted yesterday that was featured in the Daily Mail with Alice Hart Davis, who is a very renowned and very experienced journalist who I've met before and who I've known actually since I started in aesthetics 11 years ago. And she's a highly respected journalist who has really been in the aesthetic industry for many, many years. And I think the feature that she wrote was great because she's really highlighted an issue that I've been talking about in clinic and with patients for many, many years, and which is really not understood by people. And I'm so glad that this was featured because I think it really does increase awareness about this issue of residual filler. And what this basically means is that filler that is injected is not actually dissolved 100%, despite what you might be told by the doctor or the practitioner who's doing your treatment. I'm not saying that people are deliberately lying or misinforming you when they say that filler usually dissolves within sort of 12 to 24 months. That is what companies are telling people, the doctors, when they're training them. And the studies so far have been very limited. So they've been saying this based on very limited studies and information. But certainly, as you can see from the article, MRI scans show that often people who've had filler treatments in the past have residual filler, and in Alice's case, for 20 years after having had treatment. So filler can really stay around in the face for many, many years. And I think, this article highlights two things, for me. One is that, filler treatments are, not like going to have a haircut. They have serious long-term implications. And I think you need to choose your practitioner, your doctor wisely. There is always a risk of complications, and I think you reduce that risk by going to someone who's experienced and well-trained. And unfortunately in the UK, there is the issue of filler not being prescribed by doctor, so anyone can theoretically get it and inject it. So that's a real issue and a cause for concern. So I think that's very important to emphasize. But secondly, I think it's also just the understanding that there are often long-term implications that we may not know of even now, of certain products that we might be injecting into our faces. So I think it's it's really good to make an informed and an educated decision when you're choosing what treatments to have. And there are implications for having residual filler in your face from an aesthetic point of view. I think Alice makes the point that she's been very happy with her treatment and she would continue to have treatment, and that's because she's also been very lucky. She hasn't had any migration or movement of the filler. I've seen patients over the years where they've had filler injected in one place and it's moved somewhere else, and that's totally changed their appearance, and that can happen. And I think it's just something to be aware of, particularly if you're going to then inject filler again into the face, the same area year after year after year over a long period of time. So certainly this is something that we need to be aware of. And as I said in my post, my concern is that I feel now people are just having filler treatments, injectable treatments at far too young an age. And as a result, they're just having far too much injected into their faces, and ultimately, I don't think that's leading to a more youthful look. I think it's actually aging, and that's really my take on it. So I think you have to be very careful about the treatments that you're choosing to have. Of course, who is doing them for you, but I think the most important thing is to make an informed and educated decision. I'm not saying that nobody should ever have any of these treatments, each to their own. It's not something that I've had done and not something that I'm planning to do. But many of my patients have injectable treatments alongside, other treatments to support their skin. Obviously, what I specialize in and what I focus on is treatments that stimulate one's own collagen in the skin, because I believe long term that is going to get you the best, most natural looking, most youthful look. And the way that I go about this is really a combination approach. So it's looking at products with active ingredients that we know stimulate collagen. So things like the product range that I developed, Skin W1, which I specifically made to help stimulate collagen levels in the skin, because that's what I really wanted for myself and for my patients. But of course, there's retinol, vitamin A, vitamin C, all these actives we know stimulate collagen levels in the skin. I also believe you need to combine this with supplementation. And again, we know vitamin C is a building block of collagen. So liposomal vitamin C supplements are definitely something that I recommend. And finally, I think treatments that stimulate collagen levels in the skin are really important. And the sort of treatments that I specialize in and that I believe are very effective at this are, peels, which have been around for a long time, which I love, and that's really my thing, but they're incredibly effective for stimulating collagen, as well as combination treatments, things like microneedling, radiofrequency. There's a lot of technology now and a lot of combination treatments that really effectively stimulate collagen levels in the skin. So when you combine products, supplements, and treatments, you get great results and a really good long-term result. And ultimately, I think that leads to aging well, looking good, and feeling good. And I'm glad that there is more awareness now about this whole issue of residual filler. And hopefully this has explained a little bit more about what it is and how it comes about, and just a little bit of food for thought for everyone. And I just think as I always say, less is more.